how's it going?
Not bad. So my name's Ashley. I'm going to be your nurse today.
Good to see you, Ashley. Good to see you.
Good to see you too. So I see that you have an infusion that's been started.
Yeah, they're putting some stuff in my arm.
They are, to keep you nice and hydrated. I'm just going to go ahead and check and make sure that we are infusing at the correct rate, that you're getting the fluids not too quickly, not too slowly, and that we are where we're supposed to be. I'm also going to make sure that your arm looks right. Go ahead and give me your name and date of birth, Bob.
Bob Johnson, 1165.
Perfect. So that is him. I'm going to go ahead and double check that with the MAR. I do see it's 0.9% sodium chloride, so I'm going to go ahead and check that. It is the correct bag. It's a 1,000 ml bag. It was started at 1,300. The infusion rate's 125 mils per hour. The drops per minute is 21. The bag looks good. There's no particulates, no cracking. So overall, it looks really great there. I'm going to go ahead and check for any infiltration. I'm going to check that tube for any particulates, any infiltration. Sorry, the tubing looks really good. It's clean. There's no air bubbles in it at all. I'm going to go ahead and make sure too that there's no redness or swelling at his site. There's no bleeding at his site present. No phlebitis, no infiltration. I had mentioned those. And I see that in the MAR. That it was started at 1,300 again. It was correct here. It started at 1,300. It is infiltrating about at the correct rate here. We've gone through an hour and we're about where we need to be on this bag. I'm going to go ahead and wash my hands just so I can make sure everything's nice and clean. Okay, so I'm going to go ahead and check Bob's site. There isn't any swelling here. Everything looks intact. Perfect. Everything's stable. Bob, are you having any pain anywhere?
Nope. It feels great. Feels great.
Okay, perfect. All right. So I don't see any kind of issues. The skin integrity still looks good. The tubing still looks good. So the only thing left, Bob, is we're going to just make sure that this is going at the correct drip rate, okay?
Okay, sounds great.
All right. So give me just a moment. Do you have any questions for me?
Nope, not quite.
Alright, so that does look correct, Bob. That looks really good.
Oh, good.
Okay, so the next thing we're going to talk about, which I'm sure your nurse went over with today, we want to make sure that this site stays very clean, and we want to make sure that it stays dry. I know you probably haven't showered for a bit, but we're going to hold off. Once we do get all the fluids in, we can talk about saline locking you, and then we'll put a protective cover over this site, and you can get in the shower.
Okay.
Alright, so the other thing that I want to mention to you is if you have to use the bathroom or anything like that, please hit your call light and I will help wheel the IV pole into the bathroom. I don't want you to try reaching for stuff and tripping and getting things caught and ripping that IV out.
Oh yeah, that sounds like it wouldn't feel very good.
Yeah, so we just want to make sure we maintain that site really good. It looks awesome. As long as it feels good, there's no irritation, no redness, no swelling, which we're going to have to, I need your help with that. So if you do notice any of that, or if it starts to pinch or get any sharp pain, please let me know. Any changes in your skin color, please let me know. And you remember how to get me?
Yep, I pushed that big red button with the cross on it.
Perfect. Yep, that call light, and I will come running right away. Other than that, I'm going to come and monitor you about every hour just to make sure that this is infiltrating at the right time, that we don't have anything going on with your IV site that's going to compromise that fluid intake, okay?
Okay, every hour. So I'll call
Every
you
hour.
when the next episode of Bonanza starts.
Perfect.
Okay.
That sounds good. So I didn't have to raise his bed, so I'm going to make sure again that it is down to the lowest position that it can go. The side rails are up for patient safety. So Bob, if you don't have any questions for me, I will let you get back to your show.
Nope, I'll see you in an hour.
Perfect. So I'm going to go ahead and document on the computer that we checked the rate of infusion, the drip rate was accurate, that it is the correct solution, that he's not having any adverse reactions to that, and that we were going to go ahead and check back on him in an hour.